Hi, I am Dr. Brahmaraju, consultant orthopedic and joint replacement surgeon here at SPARSH Hospital, Mysore Road. Today I am going to talk about osteoarthritis of the knee joint. So what is osteoarthritis? Osteoarthritis is nothing but wear and tear in the knee joint structures, which leads to joint swelling, pain, restricted mobility and deformity. So osteoarthritis of the knee is a very disabling condition because it's a weight-bearing joint and the patient will be having difficulty in doing activities of daily living. So this makes them dependability on others for mobility purposes. Osteoarthritis of knee is widely prevalent in India. According to data, it ranges from 20 to 40% and the prevalence rises as the age goes on. What are the types of osteoarthritis? It may be primary, that is age-related osteoarthritis, or secondary reasons. Secondary reasons include any joint injuries happened in an earlier age, or any inflammatory conditions affecting the joint, or infection in the knee joint. So how do we manage osteoarthritis? In early osteoarthritis, the optimum combination of pharmacological and non-pharmacological methods is ideal. The non-pharmacological method is mainly lifestyle modifications. Like one should control the body weight, they should have regular physical activity, they have to do strengthening exercises for the muscles which control the joint, and also patients with the early osteoarthritis can use gait aids like cane, crutches or offloading braces. Also they should avoid excessive floor activities and climbing stairs. And the pharmacological method mainly includes the usage of NSAIDs. There are other medications which we use for long term in early osteoarthritis like glucosamine, chondroitin sulfate, and recently we are using rosehip extracts and collagen derivatives. We also use some joint injections in early osteoarthritis of the knee like steroids, platelet-rich plasma, and artificial hyaluronic acids. The main surgeries what we advocate in early osteoarthritis include osteotomies and unicompartmental joint replacement. In advanced or late osteoarthritis, the only treatment of choice will be surgery, that is total knee replacement. Total knee replacement is a highly successful surgery of the decade. Many people are undergoing joint replacement and they have better quality of life after surgery. The more recent advances in total knee replacement include the usage of highly cross-linked polyethylene, which increases the longevity of the implants, and also robotic assisted joint replacement, which from the surgeon's perspective will help in placing the prosthesis more anatomically, and also from the patient perspective will have less post-operative pain and early functional recovery. The use of patient-specific or knee-specific prosthesis is also under evaluation. I think the following information is useful. Have a healthy and happy life. Thank you.